Contraception, or more commonly known as birth control. Contraception is practiced all over the world to prevent pregnancies. But what do we really know about the details of contraception?
Contraception is the prevention of the fusion of gametes during or after sexual activity. The term contraception is a contraction of contra, which means against, and the word conception, meaning fertilization. Contraception can occur both naturally and via artificial means in humans and in animals. Naturally occurring contraception. When a mother feeds her baby only with her breast milk, this tends to prevent the release of hormones which cause ovulation. This occurs naturally, but it can also be manipulated as a method of birth control called the lactational amenorrhea method.
The techniques of birth control can be classified and is by the stage of reproduction during which it is active. A form of birth control which prevents the sperm from fertilizing the egg is a contraceptive agent. A form of birth control which acts after fertilization to prevent or interrupt the implantation of the embryo into the uterine lining is a contragestive agent. After implantation has occurred, an agent which ends gestation by terminating the pregnancy is an abortifacient. These mechanisms of action are not always mutually exclusive. One substance or device can have more than one potential effect, depending upon when it is used. There are a variety of laws in many countries which prohibit or regulate the availability of contraceptive devices. The laws range from outright prohibition to prohibition of some forms of contraception, to minimum ages for availability, to whether a prescription is required, etc., etc.
A study in 2007 showed that 62% of sexually active students use a condom at last sex and 39% did not. In 2007, 16% of sexually active students use birth control pills at last sex. In 2007, twice as many white students as black students and Hispanic students reported using birth control pills before last sex. Condom use at last sex increased from 1991 to 2002. Female teens, contraceptive use in their first sexual relationship was significantly associated with contraceptive use in later relationships. Conversely, males who did not use contraception during first sexual relationship were 66% less likely than other males to use contraception in their current relationship. Females who did not use contraception at first sex were also likely than other females to use contraception in later relationships. For females, if a partner was initially a stranger to her, she was less likely to use contraception than if a partner had been previously known to her. In addition, females' likelihood of using contraception was reduced by 20% for each additional partner they had ever had. Males who reported engaging with their partners in more couple-like activities were almost twice as likely to have ever used and always used contraception. For females, having discussed contraception before sex was also associated with increased odds of having ever used and consistently used contraception in later relationships. Women with ambivalent attitudes towards pregnancy use contraceptives less consistently and effectively than those with clear, firm motivation to avoid pregnancy. Males who suffered sexual abuse in the past were far less likely to use contraception than males who never suffered such abuse. A sexually active teen who does not use a contraceptive has a 90% chance of becoming pregnant within a year. The majority of sexually experienced teens use contraceptives the first time they had sex. The condom is the most common contraceptive method used at first intercourse. 68% of females and 80% of males use it in the first time they have sex.
They say contraception is inherently wrong because it is unnatural, it is anti-life, it separates sex from reproduction, and it also carries health risks. And they also say that contraception leads to immoral behavior because it makes it easier for people to have sex outside marriage. And it can also lead to widespread sexual immorality. However, there are also people who say that contraception is not wrong because it provides also human rights benefits. This may lead to debates of pro-life versus pro-choice. However, to be safe, it is better to abstain from sex. Abstinence is the best contraceptive.